Hi everyone and welcome. In today's clinical education and training session, we're going to review one of the most fundamental nursing procedures you'll perform throughout your career: intramuscular injections in adult patients. This skill refresher is designed specifically for second semester nursing students as you prepare to participate in upcoming flu clinics, where you'll be administering vaccines to healthcare professionals in real-world settings. I'm Jennifer, an RN and BSN emergency room nurse for 16 years, and I'll be guiding you through this focused review and demonstration to help you build confidence, reinforce safety, and care for others with clinical excellence. The purpose of this session is to ensure you're well prepared and clinically competent in administering IM injections to adult patients. This is more than just a checklist item. It's a moment of trust and skill, and it's also responsibility in nursing care. So by the end of this session, you will be able to identify common IM sites, appropriate equipment, demonstrate safe and effective technique, assess site readiness and patient-specific factors, recognize contraindications and adverse reactions, and apply the full scope of medication rights to ensure your patient's safety. You'll also practice therapeutic communication because how we speak and connect with our patients is just as important as the technical steps we follow. So let's get going. Before we ever draw up or administer an intramuscular injection, we must begin with the 8 rights of medication administration. These rights are the foundation of nursing safety and ethical practice. We must ensure the right patient is receiving the right medication in the right dose, through the right route, at the right time. And we also must document this information properly. But there are 3 additional rights we can't overlook: the right reason or indication, ensuring there's a valid therapeutic indication, and the right response, observing the patients for expected outcomes. These rights are not just about checking boxes, they represent your critical thinking, your attention to detail, and your commitment to safe, person-centered care. Now let's discuss equipment. Because selecting the correct needle size and volume is essential to avoiding complications and delivering medication effectively. For adult intramuscular injections, we typically use a 21 to 23 gauge needle. And the length is between 1 to 1.5 inches, depending on the patient's muscle mass and the chosen injection site. In terms of fluid volume, the deltoid muscle can usually tolerate up to 2 millimeters. The ventrogluteal site, which is often considered the safest site for adults, can accommodate up to 3 millimeters. And the vastus lateralis, located on the lateral thigh, also allows 2 to 3 millimeters, depending on muscle development. Always use your clinical judgment when selecting a site and needle that's appropriate for your individual patient's size, condition, and comfort. For instance, a geriatric patient that's quite frail, although the deltoid muscle allows up to 2 millimeters, for these frailer patients, 2 millimeters is too much. And really, 1 millimeter would be a lot. For many of those patients, I prefer to just go straight to the ventrogluteal site because it's safer for them with a larger muscle size. Let's take a closer look at the 3 most common intramuscular injection sites for adults: the deltoid, ventrogluteal, and vastus lateralis. The deltoid is easily accessible, but it can only accommodate up to 2 mL of medication, and this medication should be non-irritating and a smaller volume. You'll find the correct site by locating the acromion process and injecting 2 to 3 finger breaths below. The ventrogluteal site is considered the safest for larger volumes and viscous medications. It's free of major nerves and blood vessels, and it's tolerated really well in adults. To locate it, use your opposite hand or your non-dominant hand to find the greater trochanter and place your fingers into a V shape toward the anterior superior iliac spine. You can see this demonstrated in the picture below. The vastus lateralis is a really good option, although it requires you being in a private room, obviously with patient privacy, so they can remove their pants or clothing. But It's a strong, thick muscle on the lateral thigh and is a great option for patients who may not tolerate injections in the gluteal region. So during your lab, you'll palpate these landmarks and build muscle memory for accuracy by using our trainers. So first and foremost, we must assess our patients and the environment. We want to check for allergies, both medication related and latex related. Then we evaluate the proposed injection site. Is there any tenderness, swelling, bruising, infection present? We want to avoid any site that shows signs of damage or inflammation. And think critically about muscle mass again, the patient's position, and their ability to remain still and relaxed. Always consider underlying conditions like bleeding disorders or neuropathy that might increase their risk for complications. And just like I learned in the ER, never assume. Even if the patient looks tough but seems anxious, ask. Invite them to express any discomfort or concerns and educate them on what to expect. That small moment of connection can really make a big difference. We'll now walk through the step-by-step procedure for administering an IM injection, following best practice and safety standards. Of course, we always start by performing our hand hygiene and donning the appropriate PPE, in this case, clean gloves. We'll identify the patient using 2 patient identifiers, and we verify the medication order, including the dose, route, and the medication's expiration date as listed on the label. We'll gather our supplies, including the correct syringe and needle size based on our chosen site and the medication's viscosity. We'll select the injection site using proper anatomical landmarks and cleanse it with alcohol swab in a circular motion. For adults, we insert the needle at a 90-degree angle, using a Z-track method when appropriate to seal the medication within the muscle and reduce irritation. We'll inject slowly and steadily and then withdraw the needle at the same angle. Upon withdrawal, we'll immediately activate the safety device, apply gentle pressure over the injection site, and cover it with a Band-Aid. Dispose of all sharps properly, remove your gloves, once again perform hand hygiene, and make sure you have that calm confidence while you're in the room with the patient. Those are really key. So when we practice, let's do so carefully and not rush through it. When you are doing your evaluation in front of the clinical instructor, make sure that you have reviewed your validation checklist and that you have it present so we can sign you off for all the skills. Intramuscular injections are generally considered safe, but there are some contraindications and potential complications that we should all be aware of. We want to avoid IM injections in areas with signs of infection, significant bruising, muscle atrophy, or impaired perfusion. Patients with bleeding disorders or those that are on anticoagulants may be at higher risk for hematomas, and in that case, we might want to reconsider alternate routes. Complications can include nerve injury, particularly if anatomical landmarks are not followed, or abscess formation if aseptic technique is compromised. We always want to monitor our patients closely for any allergic reactions and educate them on what symptoms to report after they leave your care. Your situational awareness, technique, and communication can significantly reduce risk. So take your time with each patient. Monitoring after administration of injections is crucial. So after administering, you want to monitor for at least 15 minutes, especially if it's a new medication or vaccine. Look for signs of dizziness, pallor, sweating, shortness of breath, or rash. When you document, you want to include the medication's name, dose, and site used, the time of the administration, the patient's response, and any teaching materials provided or concerns expressed. Always chart as if someone's safety depends on your notes, because it does. Good documentation is an extension of good care. So we'll wrap up today's session with a few reflection questions to help you internalize what we've practiced. Because every injection is more than just a task. It's an opportunity to build trust and deliver care with skill and sensitivity. Think about this. What part of the IM injection process do you feel most confident in? And what part do you still want to keep improving? How can small, routine procedures like this one impact a patient's trust and comfort? I do want to tell you a story. Back when I was working in the ER triage, I had this very large man, over 200 pounds, who needed an IM injection for antibiotics. He was so strong, his arms were bulging, stoic, completely unbothered, and I administered an injection into his deltoid while he sat on the edge of the gurney. Midway through, he started to slump forward, and I couldn't hold him up. He slid to the ground, pale, sweaty, and completely unconscious. When he came to, he looked at me and said, "Oh no, did I pass out again?" He had a known history of fainting with needles, but he just didn't mention it. That moment taught me something I'll never forget. I can never assume how someone feels based on how they look. Now, if I sense even mild anxiety, I ask the patient about their feelings, if I prefer them to lie flat on the gurney, and I monitor them very closely afterwards. Needle fear is more common than you think, and patients often don't feel comfortable sharing it unless we create a safe space to ask. So I leave you with this. Have you ever received an injection that left a lasting impression, good or bad, with you? And what can you learn from that? Using therapeutic communication, offering reassurance, and establishing rapport in short interactions is possible. Even the smallest moments can become the most memorable. So let's continue to grow in awareness, precision, and compassion, one patient at a time. If you have any other further questions regarding IM injections, please ask them or address them now. And if not, make sure that you have your skill validation checklist on hand, and we'll start going through them right now within the skills lab. Thank you for listening.